The effectiveness of HRT for postmenopausal women. Hey there, ladies. Are you navigating the world of postmenopause and feeling the effects of hormonal changes? If so, look, you're not alone. In fact, hormone replacement therapy might just be the solution you've been looking for. We treat in our medical clinics way more females than males when it comes to HRT. So join me on a journey to explore the ins and outs of HRT for postmenopausal women. And stick around until the end to find out how you can actually decrease those really annoying hot flashes. Today, we're going to be talking about HRT for you ladies out there going through the pain of menopause or who have already gone through it. We're going to be answering all the questions you ever have had. I'll be talking about how it works, what it does inside your body, how to know if you're an actually good candidate for it, what the treatment options are, what they look like, the results, how much it costs, and what the side effects are. The chapters in this video are always in the description in case you wanted to skip to anything specifically. Don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of hormone replacement therapy? Have you had it before? Have you not? What have you read about it? And would you even get it? Why or why not? I'd love to hear your thoughts and help anyone out in the comments that I possibly can. Let's dive in. How does HRT actually work? Well, hormone replacement therapy, or HRT, works by supplementing the body with hormones that have declined during menopause, such as estrogen, progesterone, testosterone. These hormones will help alleviate menopausal symptoms like hot flashes, vaginal dryness, and mood swings. Estrogen therapy specifically can help prevent bone loss and reduce the risk of fractures as well as those pesky hot flashes. Progesterone is often prescribed alongside with estrogen to protect the lining of the uterus at the same time. So HRT can be administered in various forms: pills, patches, creams, gels, injections. It just depends on the individual and how comfortable they are taking the medication. The goal of HRT is to restore hormonal balance and improve the quality of life for women experiencing menopausal symptoms as a result of low hormones. So how do you know if you're a good candidate? Well, number one, determining if you're a good candidate for HRT involves always getting blood work. Now, when would you get blood work? Well, if you're experiencing menopausal symptoms such as hot flashes, night sweats, mood swings, vaginal dryness, difficulty sleeping, and these symptoms are affecting your quality of life, you may benefit from HRT, and it's time to get your blood work done. And this can happen really at any age. So not everybody is a suitable candidate, however. So your healthcare provider is going to look at your blood work, your medical history, your health, your family history, and they may also look at the severity of your symptoms versus the risk factors of certain conditions such as heart disease, stroke, or breast cancer, and whether or not you've undergone hysterectomy to decide if HRT is best for you. So you always want to be open and honest with your provider about your symptoms, concerns, your medical history to determine if HRT is the right option for you. They will be able to provide personalized advice. One of the things I don't recommend you do is going to your normal primary care provider who isn't going to check progesterone, estrogen, testosterone levels as part of your hormones. If you have a doctor and they say they checked your hormones and all they did was check thyroid hormone, then run the other way and find a different doctor. So what does HRT treatment/procedure look like, and how many times and how often do you have to do it? Well, HRT involves taking medications containing hormones to replace the ones that you're no longer producing in sufficient amounts. So typically with estrogen and progesterone, you'll take through pills or creams or even pellets on the estrogen side. Progesterone usually isn't done in a cream or pellet form. However, on the opposite side, when it comes to testosterone, you'll have injections, you'll have transdermal patches, you can have pellets, and all of the above. So number one, oral tablets. Hormone medications can be taken orally, usually once a day. Number two, patches. Hormones can be absorbed through the skin via patches applied to the skin, usually typically changed twice a week, sometimes 3 times. Number three, gels, creams, sprays. Hormones can be directly applied to the skin and absorbed into the bloodstream. Now, frequency may vary depending on the type of product. Number four, vaginal creams or rings. So for women experiencing vaginal symptoms like dryness, creams or rings containing hormones can be inserted into the vagina and help with this. Number 5, pellet therapy. So hormone pellets are small little rice granules that are made of hormones. They have estrogen and testosterone. Usually they don't have a progesterone version. And this is inserted under the skin under a small incision, and they release the hormones gradually over several months, usually 3 to 4 for women. The frequency and duration of HRT really depends on your individual factors, the severity of symptoms, response to your treatment, and ongoing health assessments and blood work. We want to make sure that you are leveling out and getting to your normal and optimal levels of hormones. So it's essential to follow your healthcare provider's instructions carefully and have regular follow-up appointments to monitor your progress while on the treatment to adjust it as needed. So what are some of the results from HRT? Why are we looking to do this in the first place? So it's definitely going to vary from individual to individual. However, our goal always with women on HRT is to help them experience significant improvements in the quality of life. So number 1, we want to help them have relief from menopausal symptoms. So hot flashes, night sweats, vaginal dryness, mood swings. Many women find that symptoms become less severe or resolve entirely while they're on HRT. Number 2, improved bone health. So estrogen plays a crucial role in maintaining bone density and thickness. And testosterone can help women work out and lift more weights, which also increases the bone health. So it helps reduce the risk of osteoporosis and fractures in postmenopausal women. Number 3, reducing the risk of heart disease. So estrogen has cardioprotective effects. There are some studies that suggest HRT may help lower the risk of heart disease in young women who start treatment early in menopause rather than later. Number 4, enhanced quality of life just all around. So by alleviating menopausal symptoms, women feel better, you sleep better, you have your libido back, you have more energy. All those things can help you live a better quality of life and feel more like yourself again. And number 5, management of other symptoms. So in addition to menopausal symptoms, HRT also manages hormonal imbalances, mood disorders, cognitive changes, urinary symptoms as well. So many times we see females that have been diagnosed with midlife crises or depression or anxiety, and when you look at their hormones, they are completely imbalanced. And many times when we balance those hormones, they're able to get off of their medications. It's important to note that while many people benefit from HRT, it's not suitable for everyone. So your healthcare provider is going to assess your risk, look at your blood work, your history, before they recommend HRT and what treatment is the safest and most effective for you. How much does HRT cost? So the cost of hormone replacement therapy can vary widely, including the type of treatment, the specific medications, the dosage, the duration of treatment, your location, how skilled the provider is. So there is a wide range from hundreds to thousands of dollars when it comes to hormone therapy. However, you always have to think about the good rather than the price. If you want to live better, sleep better, have better sex, have more energy during the day, those are all things worth spending on yourself rather than buying that new purse or that coffee or that iPhone. Those are things you want to put into yourself to make yourself feel the best that you possibly can. So let's talk about the side effects. HRT can have various side effects, and it really depends on the type of hormones used, the dosage, the method of administration, and individual health factors. So some of the most common side effects associated with HRT are number 1, breast tenderness. So some individuals may experience a little bit of breast tenderness or enlargement, especially during the initial stages of HRT, and this usually levels itself out and goes away. Nausea. So hormone medications sometimes can make people feel nausea with some stomach discomfort. Very rare, very brief. Headaches or migraines can also occur as a side effect of HRT. Fluid retention. You might bloat a little bit, but this is okay. You're not gaining weight. The bloating is just because your body is getting used to having your hormones back. Again, usually after a couple weeks, this levels out and goes away. Mood changes. Hormonal fluctuations can affect your mood, emotional well-being. So there might be some mood swings, irritability, or changes in anxiety or depression, all which have been shown to improve when your hormone levels are balanced out. So it's worth a little bit of short time of maybe irregularity, which you already are irregular, to get back to normal. Number 6, irregular bleeding. So some women taking estrogen progesterone can have irregular vaginal bleeding, spotting, even restart of their cycles after they've had menopause because of this. So hot flashes. While HRT is often used to alleviate hot flashes, some individuals may experience a little bit more hot flashes or flushing as a side effect before it gets better. Changes in libido. So this is the most important one that both husbands and wives thank me for. It increases sexual desire and function. So usually it goes up significantly during the beginning part of HRT and then levels out while you're balanced. Weight changes. Hormonal changes can affect metabolism and body composition. So you might have a little bit of weight gain because you're gaining muscle at the beginning. However, it can also help with weight loss. If your metabolism is terrible, which is controlled by your testosterone and your hormone levels, then replacing that will help you lose weight, help you get in the gym, help you feel more energetic. Increased risk of blood clots. Estrogen-based hormone therapy can slightly increase the risk of blood clots, so particularly in women that have existing conditions. So it's always great to make sure that you get clearance from your provider and talk to your provider about this. And increased risk of breast cancer. This is the most important one that everybody wants to know. Long-term use of estrogen and progesterone combination therapy may be associated with a slight increased risk of breast cancer, especially when taken for more than 5 years. However, if you optimize a female's hormones at a low level and you watch them and you do the labs you're supposed to do, we have had women on hormone therapy for decades without any side effects. It's just making sure that you're being properly managed, properly monitored, and reviewed over and over and over. There are other risks depending on the type of hormones used, but those are specifically for those related to cardiovascular health, bone health, other medical conditions. So you always want to talk about the risks and the benefits with your doctor, and in many times, the benefits will greatly outweigh any type of risks to make you feel better again. If you experience any side effects, always talk to your doctor, always bring it up to them. It's possible to adjust your treatment plan and get you the relief that you really, really deserve. Now let's get into the bonus, hot flashes. So hot flashes are a common symptom of menopause. They could be very uncomfortable. You wake up drenched in sweat. During the day, you have a hot flash, anxiety, and feel like you're sweating or feel like you're anxious and want to choke. So hormone replacement therapy is an option for managing that. And there are several non-hormonal strategies that may help alleviate it at the same time. So what should you do? Number 1, try and stay cool. So keep your environment comfortably cool. Use fans, air conditioning, opening windows, fanning yourself with a piece of paper, dress in layers that you can easily remove if you start to feel hot. Number 2, stay hydrated. Drink plenty of water throughout the day to stay hydrated. Avoid beverages that can trigger hot flashes, such as caffeine or alcohol. Number 3, maintain a healthy weight or lose weight to get within a healthy weight. Excess weight can exacerbate hot flashes. So if you maintain a healthy weight and balanced diet with regular exercise, it will help reduce your chances of having hot flashes. Number 4, avoid triggers. So identify triggers that can worsen it and then avoid it. Spicy foods, hot beverages, caffeine, alcohol, smoking. Write it down what you were doing just before you got a hot flash so you can start to see patterns and avoid them. Number 5, exercise regularly. Engage in regular physical activities such as walking, swimming, cycling, yoga. Exercise can help regulate hormone levels, improve mood, and help reduce the frequency and severity of hot flashes. Number 6, try relaxation therapy. So acupuncture, hypnosis, biofeedback, massages, those can help with hot flashes as well and reduce the chances of you getting a hot flash. Make sure you always consult with a qualified practitioner. Number 7, like the layers, dress in light clothing as well. So wear lightweight, breathable fabrics such as cotton to help stay cool and comfortable. So avoid the tight-fitting clothing that can trap heat and make things worse. And there you have it, your in-depth guide to hormone replacement therapy. If you still have any questions whatsoever or concerns, please comment them below. I'd be happy to answer them. And if you're interested in exploring HRT for yourself, click the link in the description to book a consultation with one of our experts below. Don't forget to like, subscribe, and we'll see you next time. Have a good one.